Hi, I'm Regan Walker-Perez, and I'm doing a presentation on child maltreatment, particularly trauma responses to child maltreatment and assessment and treatment. It's for CAST 303. Child maltreatment includes child neglect, psychological maltreatment, physical abuse, and sexual abuse. Um, just to go over some definitions, child neglect is defined in Chapter 7 of the APSAC Handbook on Child Maltreatment. This handbook was honestly the most helpful resource I had. I got most of my information there, but of course it's also cited in the slides. Physical, there are different ways to describe child neglect. It's defined as parental failure to meet basic needs. There are 5 different subtypes of neglect: physical, psychological, medical, mental health, and educational. Child neglect is defined in Chapter 7. And physical neglect is basically the failure to provide for the basic needs of a child, so like food, shelter, things like that. Psychological neglect describes parents who ignore their kids' psychological needs, such as the need for warmth and comfort. So parents, when their babies are crying, who just ignore them, who maybe these parents will change their diapers and feed them, but when the child needs that comfort and emotional support, the parents just ignore them. Medical and mental health neglect include not taking a child for needed health and mental health treatments and appointments, as well as ignoring serious problems in these areas. So if your child, this example is used all the time, but if your child has severe asthma and you don't take them in for their checkups and get them their medication, that's medical neglect. Mental health neglect would be if your child's severely depressed and is having like suicidal ideations and you're just ignoring it, thinking, oh, it'll get better, I don't want to worry about it. That's mental health neglect. Educational abuse or neglect, I'm sorry, is when a parent doesn't ensure their child attends school as they're legally required to. So, if your kid is staying home 2 days a week to hang out and, you're not worried about getting them to school, that definitely constitutes as educational neglect. Psychological maltreatment is defined as acts of omission and commission that are known to be psychological damaging. Examples of psychological maltreatment are basically rejecting, terrorizing, isolating, exploiting, and missocializing. I got this information on Chapter 8 of the APSAC Handbook on Child Maltreatment. The examples they give are like belittling, shaming. So if a child is showing normal emotional reactions, being sad, crying, getting angry, and you belittle them, make them feel terrible about it, shame them for normal things that are part of child development, public humiliation, if you make them stand outside with a sign that says I'm a bad boy or something like that, singling out one child to do all the chores in the house. All the other kids get to play video games, but you have to go do the dishes and do the laundry and mow the yard, or to receive all the criticism. So, the kids all didn't do their chores, but it's okay that the rest of them didn't. But you are terrible and you're very naughty and you're bad and you never listen. So just putting that all on one child. Placing the child in chaotic or dangerous circumstances is also psychological maltreatment. So like if the child is in fear, maybe nothing bad happens to them, but it could, and they know it, and they're scared. That's psychological maltreatment. Threatening violence against the child, or threatening to, destroy their belongings or hurt someone they love. If you don't be a good boy, I'm going to hit mommy, or I'm going to throw all your toys away. That's an example. Isolating the child, so not letting them talk to any other kids, any other safe adults. Exploiting or corrupting the child by modeling and encouraging antisocial behavior. So taking your 8-year-old with you while you go smoke pot and, graffiti the side of a bridge is psychological maltreatment. Physical maltreatment is defined as non-accidental physical injury inflicted on a child. Examples from the handbook are hitting, pinching, kicking, shaking, burning, beating, cutting, or torturing. It's all defined in Chapter 11 of the APSAC handbook. Children are, likely to be accidentally injured. They play hard, they do risky things, but there are ways that you can determine or suss out, what's accidental and what's intentional. When considering whether an injury is abuse or accident, it's important to consider the context of what happened, biases that you might have or that the people reporting might have. If kiddo came home with a bruise from falling off their bike, but mom's mad at dad, then she could say, oh, he has this terrible bruise. It could be, his dad's hurting him. Medical history, the consistency of the story. If the story changes for no reason or often, that's probably a bad sign. The probability that the injury is accidental. I mean, if a kid has, what looks like a mark from like an electrical cord on their bottom, like what really could have caused that accidentally? There's not much probability that it's accidental. Whereas if the kid has, a bruise on their knee, yeah, that probably was accidental. Developmental stage of the child is also an important factor. Littler kids are more likely to be clumsy and fall over and maybe hit their head and do things like that than older kids. Sexual abuse is any sexual activity with a child below the age of consent. Children below the age of consent cannot legally consent to sexual activity, so even if they want to say the kid was consenting, they cannot consent. It's not possible. The book gives the examples of sexual penetration, sexual touching, exposure, or voyeurism. And this is mostly all defined in Chapter 13 of the handbook on child maltreatment. It's important to remember that unlike most forms of maltreatment, sexual abuse is usually not committed by parents, but the offenders are usually someone who's close to the family, someone the kid knows. Think like, priests, pastors, coaches, Boy Scout leaders, Girl Scout leaders, that sort of thing, teachers. All forms of child abuse are underreported, including sexual abuse, and they're probably more common than people think. Trauma responses. When we're looking at trauma responses, it's easy to think like, oh my God, something traumatic happened to this child. They're definitely going to turn out, have bad effects. It's not necessarily true. Not all children who are abused or neglected develop negative effects. The book put it really interestingly that like humans, it looks like since most kids don't have super negative effects, humans are designed to kind of overcome these traumatic events and negative things. And exposure to traumatic events is not uncommon. kids are exposed to negative things. Like I said before, abuse is underreported. It happens more often than we think. And even aside for abuse, other traumatic events, fires, death in the family, things like that, that's not uncommon. Kids deal with that stuff. Resiliency, which is like the ability of the child to use their own internal coping skills as well as the external factors that they have in their environment to move past the trauma, as well as the duration and severity of the trauma, how long it happened, how bad it was, all have an effect on the way they'll respond to trauma. I got most of this information from Chapter 13 of the Child Maltreatment Handbook. It's even though multiple adverse childhood experiences suggest an increased risk for negative outcomes, children are very often able to overcome these experiences with no detectable negative effects. So the protective factors when it comes to trauma responses, there's been a lot of studies about like ACEs, the adverse childhood experiences, and the protective factors that can help to lessen the likelihood of negative effects. And the studies have shown that protective factors can have positive effects. Some of the protective factors that were in the study by Moore and Ramirez that I looked at included a supportive neighborhood, a safe neighborhood, non-family adult support, and safe schools. Other ones that I didn't include on the slide, just to keep the slide shorter, included TV and media restriction, religion, parents knowing their children's friends, and participation in activities. Other trauma responses to look at are cognitive and developmental issues. So kids who have been abused or maltreated are more likely to perform poorly on standardized intelligence tests. They show language delays. A lot of this is for kids who were neglected, but also, all kinds of abuse. They performed worse at every grade level academically, especially once it gets up to the older grade levels like junior high. And of course, they have attachment disorders. The cognitive issues were noted in academic performance and standardized test results. There was the Minnesota longitudinal study of high-risk parents and children that was cited in the child maltreatment handbook, and it showed a lot of really interesting stuff. It documented a lot of the negative responses to trauma in that study. Of course, maltreatment would affect a child's attachment to their parents. Chapter 7 describes a lot of this. A child will have a very difficult time forming a secure attachment to abusive or neglectful parents. This causes a lot of problems for the child's development all the way down the line. And I'll give some examples of what happens with different kinds of attachment disorders just to kind of outline why it would do that. Avoidantly attached children often have problems with behavior. They're unpopular among their peers. They may have trouble with motivation in learning, persistence in learning. If it gets too hard, they don't care, they don't want to do it anymore. And they're more likely to bully their peers and be aggressive with their peers. Resistantly attached children tend to lack self-confidence and self-esteem. They're often overly dependent on adults, teachers, daycare workers for help. They have trouble making friends. And then children with disorganized attachment have a lot of trouble dealing with their feelings and their emotions, and they're more likely to show psychopathology as teenagers. So pretty rough stuff. Emotional issues when it comes to trauma response can include lack of enthusiasm. These children are often angry, easily frustrated, they lack perseverance, they can be impulsive, they can be anxious and aggressive. In that Minnesota longitudinal study of high-risk parents and children, it showed that the teachers often ranked these children low on scales of emotional health, and they're more likely to develop mental health problems when they're older. So like I was saying, the Minnesota longitudinal study of high-risk parents and children, they showed significant emotional issues in children who experience maltreatment, most notably neglect. These children showed more unhappiness, and adolescents were more likely to be diagnosed with at least one mental illness, sometimes multiple, especially in the case of neglect. The study showed that like most of the kids that they surveyed or watched for this longitudinal study had some sort of mental illness. And the adolescents are also more likely to attempt suicide as compared to their peers. You would expect social issues, obviously, with all those other problems combined as far as trauma response goes for maltreatment. Some of these social issues include behavioral issues, such as tantrums and outbursts. These kids will have difficulty trusting others. In the case of sexual abuse, they'll have sexual behavior problems. They're more likely to either be bullies or get bullied by their peers, and they have a harder time forming friendships. Adolescents are more likely to show delinquent behavior. So the social issues, the acting out, the behavioral problems that many abused children have make it more difficult for them to succeed in a lot of areas. Of course, younger kids throwing tantrums, having extreme emotional outbursts will make it harder to make friends and, things like that. And older kids are more likely to exhibit delinquent behavior, so it's going to be harder for them to get good quality friends. They'll probably end up, gravitating more towards other kids with behavior problems. Sexual abuse victims will show inappropriate sexual knowledge, poor boundaries, and excessive masturbation. So these are things that are going to cause social problems, obviously, as well. And adolescents are more likely to experience unhappy pregnancies, abortions, and STDs, which causes huge social problems. And studies just show that sexually abused children just generally are not as socially competent as their peers. So for assessment, some things to look at when you're looking at a child who's been abused or neglected is, especially in the case of sexual abuse, parental response. In the other cases, a lot of times the parent is the perpetrator, so the parental response might not be ideal in those cases. It can definitely help, and there are treatments that include the parent, but especially in the case of the sexual abuse, parental response is one thing to look at. Abuse-related cognitive distortions, so the way the kid feels about themselves because of the abuse, the way they view the world because of the abuse. Sexual behavior problems in the case of sexual abuse is something that needs to be assessed. It can put them not only at risk of social problems, but also it can be dangerous for other kids if it's not, properly assessed and treated. Risk of revictimization is something to assess, and of course, individual and environmental risk factors. So the reaction of a parent to sexual abuse will influence the way the child reacts to it, will influence the outcome for the child. If parents are able to provide proper support and encouragement to the child after they've been sexually abused, it will greatly improve their recovery. As far as cognitive distortions go, kids will feel like it's their fault. They'll blame themselves. They'll feel guilty. They'll feel a lot of shame. And these feelings are less likely to cause serious negative effects like PTSD, depression, anxiety, if they're caught and dealt with in the context of therapy instead of, on their own. As in the case of children who have been sexually abused, parents have to be willing and able to help monitor and redirect children who act out sexually. Like I was saying before, it's for the safety of other children as well as the social well-being of the survivor. Survivors of sexual abuse also are shown to be at risk of being re-victimized. So in order to help with this, they need to be taught safety measures to try to help prevent that from happening. In the case of physical abuse and neglect, the parents are often dealing with environmental risk factors, such as poverty and unsafe living situations, domestic violence, things like that, as well as individual risk factors such as mental health issues and like unrealistic expectations and limited knowledge of child development. So those things need to be addressed as well in order to help that family. So a couple different treatment methods for kids and families who have experienced maltreatment is one is cognitive behavioral therapy. In cognitive behavioral therapy, they focus on education, skill development, gradual exposure to memories and reminders, and safety skills training. So cognitive behavioral therapy is very effective for sexual abuse survivors. Of course, in this case, it's important to include the caregiver in therapy so they're able to assist the child with behavior management and to help them, the parents, the caregivers, be able to cope with the abuse and communicate better with the children. In the case of physical abuse, cognitive behavioral therapy can help children to cope with the abuse emotionally. It can give them tools to help develop better social and emotional skills and try to keep them from getting so many of the negative trauma responses. Cognitive behavioral therapy can also benefit parents. It offers skills to promote positive parenting and just education as well. The other treatment for the maltreatment that I was interested in was play therapy. Of course, there's a lot of other ways that it's treated, but play therapy was the other one I was interested in. It reduces children's emotional distress. It allows them to process their trauma in a way they can tolerate, and it has been shown to significantly decrease anxiety, depression, and PTSD. It helps reduce distress by allowing the kids to work through their issues through symbolic communication. So if it's too much to just talk about it and put it all out there, play and symbols can help them to deal with these issues in a slower, easier sort of way. The two major types of play therapy that the The handbook on child maltreatment described were directive and non-directive. Directive play therapy is shorter in duration and it has clear guidelines. Non-directive play therapy kind of gives the child a little bit more perception of control, and they can set the pace and they can, do that sort of thing without the provider giving them too much instruction. So child maltreatment is very distressing for children. It's very distressing for anyone to even hear about, really. All forms of maltreatment increase the risk for negative outcomes compared to their peers. But assessment and treatment for children who have dealt with this has been shown to be very effective at helping children develop coping skills and try to find some healing and deal with their emotions in the aftermath of maltreatment. So for my references, I did look at a study about ACEs, adverse childhood experiences, and protective factors, and of course the APSAC handbook on child maltreatment was invaluable.